Hello everyone, my name is Kayla Rodriguez and today I will be demonstrating a complete resistance training session designed according to evidence-based exercise science principles. This workout consists of a proper warm-up, 6 resistance training modalities, and a cool-down with static flexibility exercises. Throughout this demonstration, I will explain the purpose of each exercise, proper setup, execution, coaching cues, targeted muscle groups, breathing techniques, common movement errors, and the reasoning behind each progression from an easier to a more advanced variation. Proper exercise technique is essential not only for maximizing performance but also for reducing injury risk. Therefore, every exercise should be performed with controlled movement, a neutral spine, proper joint alignment, and appropriate breathing mechanics. For each repetition, remember to inhale during the eccentric or lowering phase and exhale during the concentric or lifting phase. This is also known as the sticking point for the concentric phase. This breathing pattern helps maintain trunk stability, promotes efficient force production, and reduces unnecessary increases in blood pressure associated with prolonged breath holding. Now we can begin the warm-up. Before beginning any resistance training session, a proper warm-up should always be performed. According to the NSCA, the purpose of a warm-up is to prepare the body both physiologically and psychologically for physical activity. A proper warm-up increases heart rate, blood flow, muscle temperature, oxygen delivery, metabolic activity, and nerve conduction velocity. These physiological changes improve muscular contraction speed, reaction time, force production, joint mobility, and movement efficiency. Warming up also prepares the nervous system, allowing muscles to activate more effectively before resistance training. Today's warm-up follows a general warm-up and a specific warm-up that prepares the exact muscles and movement patterns required during today's workout. So for the general warm-up, the first component of today is the incline treadmill walking for approximately 10 minutes. This serves as a general warm-up and corresponds to the race component of the ramp protocol by increasing heart rate, respiration, circulation, and muscle temperature. Walking on an incline increases activation of the gluteal muscles, quadriceps, hamstrings, and calf musculature while remaining at a low to moderate intensity that prepares the cardiovascular system without causing fatigue. The purpose is not to create exhaustion here, but rather to gradually prepare the body for higher intensity exercise. Throughout this treadmill walk, maintain an upright posture with your head facing forward, shoulders relaxed, and arms swinging naturally. Keep your core engaged and avoid leaning heavily on the treadmill handrails, as this does reduce the lower extremity muscle activation and alters normal gait mechanics. And again, remember to breathe normally throughout the warm-up while maintaining a comfortable pace. For this general warm-up, I am going about 3.5 miles per hour and at a 3% incline. So now that the body temperature has increased, we will transition into the specific warm-up. Unlike the general warm-up, which prepares the entire body, the specific warm-up focuses on mobilizing the joints, activating the muscles, and rehearsing the movement patterns that will be used during today's resistance training session. This portion primarily represents the activate, mobilize, and potentiate components of the ramp protocol. The first exercise for the specific warm-up is shoulder circumduction or arm circles. This dynamic mobility exercise prepares the glenohumeral joint by moving the shoulder through multiple planes of motion while increasing blood flow to the deltoids, rotator cuff musculature, and scapular stabilizers. You're going to perform 10 forward circles followed by 10 backward circles using slow, controlled movements. Throughout this movement, maintain an upright posture with a neutral spine while allowing the movement to occur at the shoulder joint rather than the trunk. Avoid shrugging the shoulders toward the ear or using excessive momentum. So the purpose is to improve mobility and prepare the shoulder complex for pressing, rowing, and pulling exercises later in the workout. The next exercise is band pull-aparts. This exercise activates the posterior shoulder musculature, including the posterior deltoids, rhomboids, and middle trapezius, while promoting proper scapular movement and postural alignment. To set up this movement, you're going to stand with the feet approximately shoulder width apart and hold the resistance band using a closed supinated grip. Begin with the arms extended in front of the body at shoulder height. Retract the scapulae by pulling the band apart while maintaining extended elbows, and then slowly return to the starting position under control. Throughout this movement, avoid elevating the shoulders, excessively arching the lower back, or allowing the elbows to bend during the movement. Activating these muscles before upper body resistance exercise improves shoulder stability, and may reduce the risk of compensatory movement patterns during pressing and pulling exercises. Next are body weight squats, a dynamic lower body movement that activates the quadriceps, gluteus maximus, hamstrings, and core musculature while increasing mobility of the hip, knees, and ankles. To set up this movement, you're going to want to stand with the feet approximately shoulder width apart and toes pointed slightly outwards. Brace the core and maintain a neutral spine throughout the movement, and then descend by simultaneously flexing the hips and knees while keeping the chest upright and allowing the knees to track in line with the toes. Then return to standing by extending the hips and knees simultaneously. Common errors in this movement include allowing the knees to collapse inward, lifting the heels off the floor, or rounding the lumbar spine. This exercise also serves as movement rehearsal since squatting mechanics will be required later during the front squat exercise. Our next movement will be dynamic leg swings. This movement prepares the hip joint by increasing active range of motion while activating the hip flexors, hamstrings, gluteal muscles, and hip abductors. You're going to perform 10 repetitions in the forward and backward direction, followed by 10 repetitions side to side on each leg. This movement should be controlled and gradually increase in range of motion without forcing the joint beyond a comfortable limit. Avoid using excessive momentum or rotating the trunk to create additional movement. The goal here is to improve mobility while maintaining muscular control again. Our next movement for the specific warm-up will be walking lunges with trunk rotation. Walking lunges with trunk rotation dynamically prepare the lower extremities while simultaneously activating the core musculature. This movement improves hip mobility, balance, coordination, and multiplanar movement control. Step forward into a lunge position while maintaining an upright trunk. Once the front knee reaches approximately 90 degrees of flexion, rotate the trunk toward the lead leg before returning to center and stepping forward with the opposite leg. The primary muscles in this movement include the quadriceps, gluteus maximus, hamstrings, hip stabilizers, and abdominal musculature. Something to avoid is Avoid allowing the front knee to collapse inward or leaning excessively forward during the movement. The final specific warm-up exercise is the inchworm walkout. This movement dynamically activates the shoulders, core musculature, hip extensors, and posterior chain while reinforcing proper trunk stability and shoulder control. You're going to begin standing with the feet approximately hip width apart. Perform a hip hinge while maintaining a neutral spine until both hands contact the floor. Then walk the hands forward until reaching a high plank position, ensuring the shoulders remain directly over the wrist and the body forms a straight line from head to heels. Reverse the movement by walking the hands back toward the feet before returning to standing. Avoid allowing the hips to sag excessively, arching the lower back, or bending the knees excessively during the hip hinge. This exercise integrates upper body stability, core activation, and posterior chain mobility, making it an excellent final preparation before resistance training. So now that our body has been properly prepared through both a general and a specific warm-up, muscle temperature has increased, movement quality has improved, and the nervous system has been activated, we are now ready to begin the resistance training portion of today's workout, starting with barbell resistance training. Barbells are considered one of the most effective training implements for developing muscular strength, muscular hypertrophy, and power because they provide constant external resistance throughout the movement. Unlike machines, barbells require the lifter to stabilize the load in multiple planes of motion, resulting in greater activation of stabilizing musculature and improved neuromuscular coordination. Barbells also allow for progressive overload by making it easy to increase resistance in small increments over time. Throughout these exercises, I will maintain a neutral spine, proper breathing mechanics, and controlled movement during both the concentric and eccentric phase. The first exercise is the barbell bench press, a bilateral multi-joint upper body pushing exercise. It is one of the most commonly prescribed exercises for developing upper body strength because it simultaneously trains several large muscle groups while improving pushing performance used during sports and activities of daily living. The primary purpose of the barbell bench press is to increase maximal upper body strength, muscular hypertrophy, and muscular endurance depending on the training program. This exercise primarily strengthens the pectoralis major, which is responsible for horizontal shoulder adduction, the anterior deltoid, which assists in shoulder flexion, and the triceps brachii, which extend the elbow during the pressing phase. Because multiple joints and muscle groups work together, the bench press is considered a functional compound exercise that efficiently develops upper body force production. So, before lifting the barbell, proper setup is extremely important for both performance and safety. You're going to want to lie supine on the bench while establishing the 5 points of contacts. So the head is in contact with the bench, the upper back and shoulders is in contact with the bench, the gluteal muscles is in contact with the bench, and your left and right foot lay flat on the floor. Maintaining these 5 points of contact provides a stable base of support, improves force transfer from the lower body through the upper body, and helps maintain proper spinal alignment throughout the lift. For your grip, you're going to want to grip the barbell using a close pronated grip with the hands positioned slightly wider than the shoulder width. A close grip is highly recommended because the thumb wraps around the bar, increasing control and reducing the risk of the bar slipping from the hands. The wrist should remain neutral with the bar positioned directly over the forearm to efficiently transfer force. To execute this movement, you're going to want to begin by unracking the bar while maintaining fully extended elbows. Position the bar directly above the mid chest, and before beginning the movement, you want to retract and depress the scapulae. This creates a stable foundation for the shoulder joint and improves pressing efficiency. During the eccentric phase, slowly lower the bar toward the middle of the chest while inhaling, maintaining approximately a 45 to 75-degree angle relative to the torso. Excessive elbow flare does increase stress on the shoulder joint, so that is something you should avoid. And once a bar lightly contacts the chest, press vertically upward by extending the elbows and horizontally adducting the shoulders while exhaling. Continue pressing until the elbows are fully extended without forcefully locking the joints. Our first variation uses a reduced range of motion. This variation is very appropriate for beginners individuals returning from injury, or those still developing confidence with this movement pattern. By decreasing shoulder horizontal abduction at the bottom of the lift, joint stress is reduced while allowing the individual to practice proper bar path, scapular positioning, and breathing mechanics. All you needed is a foam pad to do a reduced range of motion bench press. Our second variation performs the complete movement through a full range of motion. The bar is lowered until it lightly contacts the chest before returning to full elbow extension. Using the full range of motion maximizes muscular recruitment and improves strength throughout the entire movement. Our final variation incorporates a 2-second isometric pause with the bar resting lightly on the chest. This pause eliminates the contribution of the stretch shortening cycle, requiring the muscles to generate force from a dead stop. As a result, muscular control, starting strength, and movement stability are improved. Some common technique errors include bouncing the bar off the chest, which reduces muscular tension and may increase injury risk, allowing the elbows to flare excessively, lifting the hips from the bench and losing the 5 points of contact, hyperextending the wrist, lowering the bar too quickly without eccentric control, and proper technique should always take priority over lifting heavier weight. The next exercise is the barbell front squat, a bilateral multi-joint lower body exercise that develops lower body strength while requiring significant core stabilization. Compared to the back squat, the anterior bar position encourages a more upright trunk posture, placing greater emphasis on the quadriceps while also challenging trunk stability. The primary movers include the quadriceps, which extend the knees during the ascent, and the gluteus maximus, which extends the hips. The hamstrings assist with hip extension, while the erector spinae and abdominal musculature stabilize the trunk throughout the lift. Because the front squat requires maintaining the barbell over the center of mass, it also develops balance, postural control, and core strength. To properly position this exercise, you're going to want to position the barbell across the anterior deltoids using the front rack position. You're going to raise the elbows so the upper arms remain approximately parallel to the floor, and then elevating the elbows prevents the bar from rolling forward while helping maintain an upright torso. You're going to stand with the feet approximately shoulder width apart and toes pointed slightly outward. And before even beginning the movement, brace the core and establish a neutral spine. For your grip, the traditional front rack grip is used whenever shoulder and wrist mobility allow. If mobility is limited, a crossed arm grip may also be used while still maintaining elevated elbows and proper bar position. Now, to actually execute the movement, you're going to want to simultaneously flex the hips and the knees, and then descend under control while maintaining an upright trunk. Keep the knees tracking over the toes throughout the whole movement, and continue descending until reaching the prescribed depth. During the concentric phase, drive through the midfoot while extending the knees and hips simultaneously until returning to the starting position. For our first variation, we're going to be doing a box front squat. So this variation introduces a box behind the athlete. And this box provides a consistent depth target while decreasing the required range of motion. This variation is very beneficial for beginners because it improves confidence, consistency, and movement mechanics before progressing to a full squat. Our second variation is our standard front squat. This variation performs the movement through the full prescribed range of motion while maintaining proper trunk posture and joint alignment. Common mistakes for the front squat is allowing the elbows to drop, rounding the lumbar spine, allowing the knees to collapse inward, also known as dynamic knee valgus, rising onto the toes, and descending too quickly without maintaining muscular control. These errors reduce lifting efficiency and may increase injury risk. And our final variation will be our heel elevated front squat. This variation elevates the heels using weightlifting wedges or small plates. Elevating the heels allow greater ankle dorsiflexion, permitting deeper knee flexion while maintaining a more upright torso. This does increase quadriceps involvement and may be very beneficial for individuals with limited ankle mobility. The second resistance training modality uses dumbbells. Unlike barbells, dumbbells require each upper extremity to work independently, making them an excellent tool for identifying and correcting muscular imbalances while improving unilateral strength, coordination, and joint stabilization. Because each arm moves independently, the stabilizing musculature surrounding the shoulder and trunk must work together and harder to control the load throughout the movement. Dumbbells also allow a greater freedom of movement because each limb follows its own natural movement path rather than being fixed to a single bar. Our first exercise for our second modality will be the dumbbell biceps curl, a single joint upper body exercise that primarily strengthens the elbow flexors. Although this movement appears simple, it is an excellent exercise for developing elbow flexor strength that contributes to many pulling movements, including rows, pull-ups, climbing, and many activities of daily living, such as lifting and carrying objects. The primary muscle responsible for this movement is the biceps brachii, whose main functions include elbow flexion and forearm supination. The brachialis, located beneath the biceps brachii, also contributes significantly to elbow flexion, while the brachioradialis assists throughout the movement. Strengthening these muscles improves upper body pulling performance, grip endurance, and overall arm strength, while also contributing to joint stability at the elbow. So to properly set up this movement, you're going to stand with the feet approximately shoulder width apart to establish a stable base of support. Hold one dumbbell in each hand using a close supinated grip, meaning the palms face anteriorly. Allow the arms to hang naturally at the sides while maintaining a neutral spine. Relax shoulders and engage core. And before beginning the movement, gently retract the scapulae to promote proper posture. Keeping the elbows close to the torso minimizes unnecessary shoulder involvement and isolates elbow flexion, allowing the biceps brachii to perform the majority of the work. And maintaining a neutral spine reduces unnecessary stress on the lumbar spine while improving force transfer throughout the body. Now, to actually execute this movement, you're going to initiate the movement by flexing the elbows while keeping the upper arm stationary. Continue curling until the dumbbells approach shoulder level, and during the eccentric phase, slowly lower the dumbbells under control until full elbow extension is achieved. Our first variation will be the alternating dumbbell curl. This means we're going to be performing one arm at a time. This variation is ideal for beginners because it reduces coordination demands and allows the individual to focus on proper technique. It also provides brief recovery periods between repetitions for each arm. Our second variation will be the bilateral dumbbell curl, and this means we're going to be performing with both arms simultaneously. Because both elbows flex together, total muscular demand increases while requiring greater postural control and trunk stabilization. Some common mistakes in this movement include swinging the torso to create momentum, allowing the elbows to drift away from the torso, performing only a partial range of motion, flexing or extending the wrist excessively, and lowering the dumbbells too quickly. And our final variation will be the bilateral dumbbell curl with a 3-second eccentric. This final variation emphasizes the eccentric phase by lowering the dumbbells over 3 seconds. And eccentric muscle actions are particularly effective for increasing muscular control, improving tendon adaptation, and increasing time under tension, all of which contribute to muscular strength and hypertrophy. The second exercise for the dumbbell modality will be the dumbbell Romanian deadlift, commonly known as the RDL. This is a bilateral multi-joint hip hinge exercise that primarily strengthens the posterior chain. Unlike the squat, which emphasizes knee flexion and extension, the Romanian deadlift emphasizes hip flexion and extension while maintaining only a slight bend in the knees. The Romanian deadlift develops strength within the posterior chain, including the gluteus maximus, hamstrings, and erector spinae. These muscles are responsible for powerful hip extension during walking, running, sprinting, jumping, climbing stairs, and lifting objects from the ground. Strengthening the posterior chain also improves posture, athletic performance, and reduces the likelihood of lower back injuries by improving hip mechanics. To properly set up this movement, you're going to stand with the feet approximately hip width apart while holding one dumbbell in each hand using a close pronated grip. Position the dumbbells in front of the thighs, and before initiating the movement, retract the scapulae, brace the core, establish a neutral spine, and maintain a slight bend in the knees. Maintaining a slight bend in the knees allows the movement to occur primarily through the hip joint while preventing unnecessary stress on the knee, and holding the dumbbells close to the thighs keeps the load close to the body center of mass, reducing the moment arm acting on the lumbar spine. To execute this movement, you're going to initiate the movement by hinging at the hips. Imagine pushing the hips directly backwards while maintaining a neutral spine. Continue lowering the dumbbells until a comfortable stretch is felt in the hamstrings while keeping the dumbbells close to the legs. Then you're going to return to standing by powerfully extending the hips and squeezing the gluteal muscles. Our first variation for the RDL will be a staggered stance dumbbell RDL. By positioning one foot slightly behind the other, the athlete receives additional balance support while beginning to shift more of the workload onto the lead leg. This progression develops unilateral strength while maintaining a relatively stable base of support. The second variation is performed while standing on a small elevated platform. This is a deficit dumbbell RDL. So increasing the range of motion requires greater hip mobility and hamstring flexibility while increasing muscular work throughout the posterior chain. The final variation is performed on one leg. This is a single leg RDL. Reducing the base of support substantially increases demands on balance, proprioception, pelvic stabilization, and neuromuscular coordination. The gluteus medius becomes particularly important during this variation because it helps stabilize the pelvis throughout the movement. Many athletic movements, including running, jumping, and changing direction, occur from one leg at a time. Therefore, unilateral exercises, like a single leg RDL, improve functional strength while helping identify and correct side-to-side muscular imbalances. Some common errors for the RDL is rounding the lumbar spine, squatting instead of hinging, allowing the dumbbells to drift away from the legs, rotating the pelvis during the single leg variation, and looking upward excessively, causing cervical hyperextension. Remember that maintaining spinal alignment is far more important than lowering the dumbbells further. The third resistance training modality utilizes the kettlebell. Although kettlebells are considered free weights, their center of mass is positioned below the handle rather than evenly distributed like a dumbbell. This unique design alters the resistance profile and increases stabilization demands during many exercises. Free weights require greater activation of stabilizing muscles because the lifter is responsible for controlling the implement throughout the entire range of motion. Kettlebells are commonly used to improve muscular strength, coordination, balance, and movement efficiency. The first kettlebell exercise is a unilateral kettlebell bent over row, a multi-joint upper body pulling exercise that develops upper back strength while improving scapular stability and unilateral muscular control. Because only one arm performs the movement, the trunk musculature must resist rotation throughout the exercise, increasing core activation. The primary muscles responsible for this movement include the latissimus dorsi, whose primary actions include shoulder extension and adduction, the middle trapezius and rhomboids, which retract the scapulae, and the posterior deltoids, and the biceps brachii, which assist through elbow flexion. Strengthening these muscles improves posture, pulling strength, shoulder stability, and performance during activities such as climbing, rowing, pull-ups, and many occupational lifting tasks. To properly set up this movement, you're going to position your feet approximately shoulder width apart while holding the kettlebell using a closed neutral grip. Perform a hip hinge until the trunk is inclined approximately 45 to 60 degrees while maintaining a neutral spine. Retract the scapulae, brace the core, and allow the kettlebell to hang directly beneath the shoulder. A hip hinged position allows the posterior chain and trunk stabilizers to support the spine while placing the latissimus dorsi in an optimal position to produce force. And maintaining a neutral grip also places the shoulder and wrist in a comfortable anatomical position, reducing an unnecessary joint stress. You're going to initiate the movement by first retracting the scapula, then flex the elbow while pulling the kettlebell toward the lower ribs or hip. Continue pulling until the elbow passes slightly behind the torso, and slowly lower the kettlebell back to the starting position while maintaining control. Our first variation uses a bench to support the non-working arm. Providing external support decreases balance requirements and allows beginners to focus on proper rowing mechanics while minimizing unnecessary trunk movement. Our second variation will be the staggered stance unilateral kettlebell bent over row. Removing the bench requires the trunk musculature to contribute more to stabilization while maintaining proper rowing mechanics. The staggered stance also develops balance and postural control without significantly altering the movement pattern. Our final variation emphasizes eccentric muscle action by lowering the kettlebell over 3 seconds. Controlling the eccentric phase increases time under tension, improves muscular control, and reinforces proper movement mechanics throughout the entire range of motion. Common mistakes include rotating the trunk toward the working arm, shrugging the shoulder instead of retracting the scapula, jerking the kettlebell using momentum, rounding the lumbar spine, and pulling primarily with the biceps rather than the back musculature. Always initiate the row by engaging the scapular stabilizers before flexing the elbow. The second kettlebell exercise is the goblet lateral step up, a unilateral lower body exercise designed to improve lower extremity strength, balance, and coordination while emphasizing frontal plane movement. Because many athletic and daily movements occur on one leg, unilateral exercises such as the lateral step up improve functional strength while identifying side-to-side muscular asymmetries. The primary muscles responsible for this exercise include the quadriceps, which extend the knee, the gluteus maximus, which extends the hip, and the gluteus medius, which stabilizes the pelvis during single leg support. Additional stabilization is provided by the core musculature to maintain an upright trunk throughout the movement. To set up this movement, you're going to want to hold the kettlebell close to the chest using a goblet grip. The goblet position keeps the load close to the body's center of mass, encouraging an upright posture and increasing anterior core activation. I'm going to stand behind the box with the lead foot position entirely on the platform while maintaining a shoulder width stance. Holding the kettlebell in the goblet position decreases the forward movement arm acting on the spine and encourages proper trunk posture, and placing the entire foot on the platform allows force to be produced efficiently through the hip and knee during the ascent. To execute this movement, you're going to drive through the heel of the lead foot while extending the hip and knee to elevate the body onto the platform. Minimize pushing off with the trailing leg so that the working leg performs the majority of the effort, and then return to the starting position under control while maintaining proper alignment of the hip, knee, and ankle. Our first variation uses a lower platform. Decreasing box height reduces the required range of motion while allowing beginners to develop confidence, coordination, and proper movement mechanics. Our second variation is the standard height goblet lateral step up. Increasing the platform height increases hip and knee flexion, requiring greater musculature force from the quadriceps and gluteal muscles while maintaining proper balance. Our final variation for the kettlebell lateral step up will incorporate a 2 second single leg balance at the bottom of each repetition. Holding the single leg position increases demands on the gluteus medius, ankle stabilizers, and core musculature while improving proprioception, postural control, and neuromuscular coordination. I did want to pause here because you can clearly see my knee collapsing inward during the step up. This movement pattern is known as dynamic knee valgus and is something we want to completely avoid during lower body exercises. As a strength and conditioning professional, it's important to recognize this common movement error and provide appropriate coaching cues or regressions. Dynamic knee valgus has been highly associated with an increased risk of ACL injury, particularly in female athletes who tend to have higher incidence of ACL tears due to a combination of anatomical and neuromuscular factors. So to correct this movement, I would first reduce the difficulty of the exercise by either lowering the box height or removing the external load, allowing the athlete to keep the knee tracking over the toes. Drive through the heel of the working leg and engage the gluteal muscles to improve hip and knee alignment. The fourth resistance training modality uses resistance bands. Unlike barbells and dumbbells, which provide constant external resistance, resistance bands provide variable resistance. As the band stretches throughout the movement, tension progressively increases. This allows resistance to better match the body's natural strength curve, meaning the exercise becomes more challenging where the muscles are capable of producing greater force. Resistance bands are inexpensive, portable, and versatile, making them an excellent training option for beginners, rehabilitation, home exercise programs, and athletic performance. So our first exercise will be the resistance band assisted pull-up, a multi-joint upper body pulling exercise that develops upper body strength while assisting individuals who are not yet able to perform a full body weight pull-up independently. The resistance band decreases the effective body weight that must be lifted, allowing the individual to practice proper pull-up mechanics while progressively building strength. Primary muscles responsible for this movement include the latissimus dorsi, which performs shoulder adduction and extension, the biceps brachii, which flexes the elbow, and the middle trapezius, rhomboids, and posterior deltoids, which stabilize and retract the scapulae. Pull-ups improve relative upper body strength, grip strength, scapular control, and pulling performance, making them beneficial for climbing, gymnastics, obstacle course racing, and many athletic activities. To properly set up this movement, you're going to secure the resistance band around the pull-up bar before placing one foot or one knee inside the band. Grasp the pull-up bar using a close pronated grip with the hands positioned slightly wider than shoulder width. Begin from a dead hang with the elbows fully extended while maintaining an engaged core and neutral head position. Before pulling upward, begin by depressing and retracting the scapulae. This activates the muscles of the upper back and places the shoulders in a more stable position. Continue the movement by flexing the elbows while driving the elbows downward toward the ribs. Pull until the chin clears the bar, then slowly lower back to the starting position under control. Initiating the movement with scapular depression and retraction activates the larger muscles of the back before the smaller elbow flexors. So that's why you should retract the scapula first, and this improves movement efficiency while decreasing unnecessary stress on the shoulder joint. Our first variation will be a partial range of motion resistant band assisted pull up. This beginner variation decreases the total range of motion, allowing the athlete to focus on scapular control and proper pulling mechanics before progressing to the full movement. Our second variation will be the standard resistant band assisted pull up. So this variation performs the exercise through the complete range of motion while maintaining proper posture and controlled movement. And our final variation emphasizes eccentric muscle action by lowering the body over approximately 3 seconds. Controlled eccentric training increases muscular strength throughout the entire range of motion and improves the ability to eventually perform an unassisted pull-up. Common errors include swinging or kipping to generate momentum, failing to fully extend the elbows at the bottom, pulling with the neck rather than the back, excessive shoulder elevation, and descending way too quickly. You're going to want to focus on maintaining control movement throughout the whole movement. The second exercise is the resistant band hip abduction, which strengthens the muscles responsible for moving the leg away from the body's midline while improving pelvic stability and lower extremity alignment. The primary muscles responsible for this movement include the gluteus medius, gluteus minimus, and the tensor fascia latae. These muscles stabilize the pelvis during walking, running, stair climbing, and single leg activities. Weakness within these muscles may contribute to excessive hip drop, dynamic knee valgus, and decreased lower extremity stability. The proper setup for this movement is to position the resistant band according to the selected variation while lying on one side, stack the shoulders, hip, knees, and ankles vertically, and maintain a neutral spine while engaging the abdominal musculature to stabilize the trunk. Maintaining proper body alignment minimizes compensation from the trunk and isolates the hip abductors, and engaging the core prevents unnecessary pelvic rotation during the movement. Now, to execute this movement, you're going to lift the top leg by performing hip abduction while maintaining slight hip external rotation. Pause briefly at the top before returning under control, and this movement should occur only at the hip joint while the pelvis remains stable. Exhale during hip abduction and inhale while returning to the starting position. Our first variation will be the sideline resistance band clamshells. So for this variation, you're going to place a resistance band above the knees. This shortens the resistance lever while emphasizing activation of the gluteus medius. Because balance is not a factor, this variation is ideal for beginners or rehabilitation. Our second variation will be the sideline resistance band hip abduction. Moving the resistance band to the ankles lengthens the resistance lever. Increasing the distance between the hip joint and the external resistance increases the torque that must be produced by the hip adductors, making the movement more challenging without increasing the band's resistance. Our final variation will be the side plank resistance band clamshell. This final variation combines hip abduction with a side plank. So in addition to strengthening the gluteal muscles, the athlete must simultaneously stabilize the shoulder, trunk, and pelvis. This increases activation of the obliques, the quadratus lumborum, gluteus medius, and shoulder stabilizers while improving overall core stability. So why add a side plank to a banded clamshell? Many athletic movements require multiple muscle groups to work simultaneously rather than in isolation. Combining the side plank with hip abduction challenges the body's ability to stabilize while producing movement, making this variation more functional and appropriate for advanced individuals. The fifth resistance training modality utilizes the medicine ball. Medicine balls are versatile training implements that can be used to improve muscular strength, coordination, balance, and movement quality. Although medicine balls are commonly associated with explosive power exercises such as throws and slams, today's exercises will be performed in a slow and controlled manner to emphasize muscular control, proper technique, and postural stability. Compared to free weights, medicine balls distribute the load differently and often encourage coordinated movement patterns involving both the upper and lower body while maintaining proper posture. The first medicine ball exercise is the medicine ball front raise, a single joint upper body exercise that primarily strengthens the muscle responsible for shoulder flexion while simultaneously challenging postural control and core stabilization. The primary muscle responsible for this movement is the anterior deltoid, which flexes the shoulder and assists with lifting the upper extremity in front of the body. Additional stabilizing muscles include the serratus anterior, upper trapezius, rotator cuff musculature, and abdominal muscles, which work together to maintain proper posture throughout the movement. Strengthening these muscles improves shoulder endurance, overhead control, postural stability, and shoulder function during many daily and athletic activities. To properly set up this movement, you're going to stand with the feet approximately shoulder width apart while maintaining a neutral spine and an engaged core. Hold the medicine ball securely with both hands directly in front of the thighs. Maintain a slight bend in the elbows throughout the movement while keeping the shoulders relaxed. Going back, a shoulder width stance creates a stable base of support while allowing efficient force transfer throughout the body, and a slight elbow flexion decreases unnecessary stress on the elbow joint while maintaining constant muscular tension throughout the anterior shoulder. Raise the medicine ball by performing shoulder flexion until the hands reach approximately shoulder height. Pause briefly while maintaining control before slowly lowering the medicine ball back to the starting position. For this movement, you don't want to go above shoulder height because this would change the exercise into an overhead movement and increase demands on shoulder mobility rather than an isolated shoulder flexion. So stopping at approximately 90 degrees of shoulder flexion keeps the emphasis on the anterior deltoid while minimizing unnecessary compensation from the upper trapezius and lumbar spine. Our first variation for this exercise will be performed while seated. So removing the lower extremities from the movement decreases balance requirements and minimizes compensation from the hips, allowing beginners to really focus in on proper shoulder mechanics. Variation 2 will be the standing medicine ball front raise with a 2-second hold. Standing increases postural demands, while the isometric hold increases time under tension, improving muscular endurance and shoulder stability. Our final variation is a single leg medicine ball front raise with a 2-second hold. So this final variation reduces the base of support by standing on one leg while maintaining the isometric hold. This progression requires the core musculature, hip stabilizers, and ankle stabilizers to work together to maintain balance while performing shoulder flexion. Some common mistakes for this exercise is swinging the medicine ball using momentum, leaning backward by extending the lumbar spine, shrugging the shoulders towards the ears, and again, raising the ball above shoulder height, and then losing balance during the single leg variation. Our second exercise for our fifth modality will be the medicine ball glute bridge. This is a lower body exercise emphasizing hip extension while strengthening the posterior chain and improving lumbopelvic stability. The primary muscles responsible for this exercise include the gluteus maximus, which is the body's largest and strongest hip extensor, the hamstrings, which assist with hip extension, and the abdominal musculature, which stabilizes the pelvis throughout the movement. Strong gluteal muscles contribute to improved posture, running, sprinting, jumping, stair climbing, and lifting mechanics while reducing compensatory stress on the lumbar spine. To properly set up a glute bridge, you're going to want to lie supine with both knees flexed approximately 90 degrees and the feet positioned hip width apart. You're going to place the medicine ball securely across the anterior pelvis while supporting it with both hands. Brace the abdominal musculature and establish a neutral pelvis before beginning the movement. You're going to drive through the heels while extending the hips until the shoulders, hips, and knees form a straight line. Pause briefly by actively contracting the gluteal muscles, and then lower the hips under control until lightly contacting the floor. For the first variation, the standard medicine ball glute bridge, this is going to establish proper hip extension mechanics while teaching the athlete to activate the gluteal muscles without compensating throughout the lumbar spine. Our second variation will be the feet elevated medicine ball glute bridge. So by elevating the feet, you increase the range of motion at the hip joint. Increasing the range of motion requires the gluteal muscles and hamstrings to produce force over a greater distance, increasing muscular demand while maintaining the same movement pattern. Our final variation will be the single leg medicine ball glute bridge. This final variation performs a bridge on one leg. So because the base of support is reduced, the gluteus medius and core musculature must stabilize the pelvis to prevent rotation. This variation also helps identify and correct side-to-side strength asymmetries. Common errors for the glute bridge will be hyperextending the lumbar spine, pushing through the toes instead of the heels, allowing the pelvis to rotate, failing to fully extend the hips, and relaxing the gluteal muscles at the top. So always think about extending through the hips rather than arching the lower back. Our final resistance training modality utilizes body weight calisthenics. Body weight exercises use an individual's own body mass as a primary source of resistance and are one of the oldest forms of resistance training. Because body weight exercises often require the body to stabilize itself in multiple planes of motion, they also improve balance, proprioception, and neuromuscular coordination. Also, body weight training is easily modified by changing body position, leverage, or stability, making it appropriate for individuals of all fitness levels. So our first exercise will be the bench dip. This is a multi-joint upper body pushing exercise primarily designed to strengthen the elbow extensors while also improving shoulder stability and upper body muscular endurance. Primary muscle responsible for this movement is the triceps brachii, whose primary function is for elbow extension. The anterior deltoid and pectoralis major assist throughout the movement, while the muscles of the scapula and core stabilize the upper body. Strong triceps contribute to improved performance during pressing exercises such as the bench press, push-ups, and overhead presses, while also assisting many daily pushing activities. To properly set up this motion, you're going to sit on the edge of a stable bench and position the hands slightly wider than shoulder width using a close pronated grip. You're going to extend the elbows while moving the hips slightly forward off the bench and maintain an upright chest, engage the core, and keep the shoulders depressed rather than shrugged. So positioning the hands directly beneath the shoulders allows efficient force transfer through the upper extremities while reducing unnecessary stress on the shoulder joint. And then keeping the chest upright also encourages proper scapular positioning and helps avoid excessive anterior translation of the shoulder. To actually execute this movement, you're going to begin by flexing the elbows while lowering the body until approximately 90 degrees of elbow flexion is achieved. Pause briefly before extending the elbows to return to the starting position. Throughout the movement, maintain an upright posture while keeping the elbows pointed posteriorly. So our first variation will be the bench dips with bent knees. This is performed with the knees flexed. So bending the knee shortens the body's lever arm, decreasing the amount of body weight supported by the upper extremities. This makes the movement more appropriate for beginners while still reinforcing proper movement mechanics. Our second variation will be the bench dips with straight legs. So extending the knees lengthens the lever arm and shifts a greater percentage of body weight onto the upper extremities. Therefore, a greater force must be produced by the triceps and shoulder musculature. Some common errors for the bench dips is descending too deeply, placing unnecessary stress on the anterior shoulder, shrugging the shoulders, allowing the elbows to flare outward, using momentum, and hyperextending the elbows at the top of the movement. Our final variation for the upper body calisthenics will be the feet elevated bench dips. So elevating the feet further increases the resistance by placing an even greater percentage of body weight onto the arms. This variation also increases demands on shoulder stability and trunk control, making it very appropriate for more advanced individuals. The final exercise is the reverse lunges. This is a unilateral lower body exercise that develops lower extremity strength, balance, and coordination while improving movement quality in multiple joints. The primary muscles responsible for this exercise include the quadriceps, which extend the knee, gluteus maximus, extending the hip, and the hamstrings, which assist with hip extension. The gluteus medius, abdominal musculature, and spinal stabilizers work continuously to maintain balance and proper pelvic alignment throughout the reverse lunge. Reverse lunge also improve functional strength because many athletic movements occur while supporting body weight on one leg. So to properly set up this movement, you're going to stand with the feet approximately hip width apart while maintaining a neutral spine and engaged core. Position the arms comfortably at the sides and establish balance before initiating movement. Beginning from a stable stance allows sufficient force transfer while minimizing unnecessary lateral movement, and engaging the core before stepping backwards improves trunk stability throughout the exercise. Now, to actually execute this movement, you're going to step backwards under control while lowering both knees simultaneously. Descend until the front knee reaches approximately 90 degrees of flexion while maintaining an upright trunk. Now, push through the heel of the front foot to return to the starting position. Our first variation for the reverse lunge will be a standard reverse lunge. So this variation introduces a unilateral movement pattern while improving lower extremity strength, balance, and coordination. Our second variation will be the reverse lunge with a 2-second isometric hold. So adding a 2-second pause at the bottom increases time under tension while improving muscular endurance, balance, and postural control. And then the isometric hold also reinforces proper joint alignment before returning to the starting position. Our final variation will be the front foot elevated reverse lunge. Elevating the front foot increases the range of motion at both the hip and knee. So the greater range of motion requires increased muscular work from the gluteus maximus and quadriceps while also improving lower extremity mobility. Some common errors for the reverse lunge is allowing the front knee to collapse inward, also, as we know is the dynamic knee valgus, leaning excessively forward, allowing the front heel to rise from the floor, taking a step that is way too short, and then losing balance due to poor trunk stability. This does conclude the resistance training portion of today's workout. Throughout today's session, each exercise was progressed by modifying movement mechanics, range of motion, stability, or body position, rather than simply increasing resistance. These progressions allow high school and college athletes of different experience levels to perform the same fundamental movement pattern while continuing to develop strength, coordination, and movement quality safely. Now, following resistance training, it is very much important to perform a proper cool down. Cool down allows the cardiovascular system to gradually return toward resting levels while promoting recovery and reducing the likelihood of dizziness associated with abruptly stopping exercise. Because the muscles are warm following exercise, this is also an ideal time to perform static stretching. So static stretching performed after exercise may improve flexibility and range of motion without negatively affecting immediate muscular power. So I will begin with approximately 5 minutes of light treadmill walking. This gradual reduction in exercise intensity helps normalize heart rate, respiration, and circulation while promoting recovery. In this cool down, I am going to 2.5 miles per hour for about half of the 5 minutes and then 2 miles per hour for the second half. The first stretch I will do is a crossbody shoulder stretch. This stretch targets the posterior deltoid and posterior shoulder musculature. You're going to hold the stretch to the point of mild discomfort, never pain, while breathing normally. And I'll be going 2 sets of 10 seconds on each side. The next stretch I will be doing is the overhead tricep stretch. This stretch improves flexibility of the triceps brachii and shoulder musculature. For this movement, you're going to maintain an upright posture while avoiding excessive lumbar extension. And again, 2 sets of 10 seconds each side. Now my next stretch will be the standing quadricep stretch with assistance of the wall just in case. So this stretch lengthens the quadriceps muscles while improving knee and hip flexibility. Key pointers for this stretch is to keep both knees aligned and avoid pulling the leg excessively with your hand. Next stretch will be the hamstring stretch on the low box. So this stretch targets the hamstrings. For this movement, you're going to hinge at the hips while maintaining a neutral spine rather than rounding the back to maximize hamstring lengthening. And for this stretch and the stretch before, I'm going 2 sets of 15 seconds each leg. Now I'll be doing the half kneeling hip flexor stretch. This stretch lengthens the iliopsoas and other hip flexor muscles. For this movement, you're going to want to maintain a slight posterior pelvic tilt while avoiding lumbar hyperextension. And again, 2 sets of 15 seconds each side. This will be the figure 4 gluteal stretch. This stretch targets the gluteal muscles and deep external rotators of the hip, including the piriformis. For this movement, continue breathing normally while allowing the muscles to gradually relax. Finally, my last stretch for today will be the standing wall chest stretch. This final stretch lengthens the pectoralis major and anterior shoulder musculature, helping restore shoulder mobility following today's upper body resistance exercise. This concludes today's resistance training session. Throughout this workout, proper exercise techniques, scientific principles, and progressive exercise modifications were emphasized to ensure both safety and effectiveness. Successful resistance training is not simply about lifting heavier weights. It requires proper movement mechanics, progressive overload, appropriate exercise selection, controlled movement, and consistent attention to posture and technique. As a strength and conditioning professional, it's very important to really emphasize the importance of maintaining a neutral spine, breathing appropriately, and prioritizing quality of movement over the amount of resistance being used. Thank you for watching, and I hope this demonstration has illustrated how proper coaching and evidence-based exercise principles can be applied to develop safe, effective, and individualized resistance training programs.